Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwanitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey everybody, welcome back to Between the Sheets. I'm pretty excited today. I have a wonderful guest from across the pond in Europe with us today. And I'm really excited because the topic that we're going to cover today is menopause and perimenopause, which is a very under talked about topic, but definitely affects women, all of us, born women. And it's really an interesting topic that we don't know as much about. So today I have Isabella Fracon, a dedicated editor, translator, curator, and blogger who has always been a fervent reader with a passion for books. After facing a challenging time during perimenopause where she felt unsupported and uninformed, Isabella underwent a transformation in her life. She became a coach specializing in perimenopause and menopause, a women's health practitioner, and a hormone replacement therapy mentor to help women navigate this stage of life with knowledge and empowerment. Her mission is to raise awareness about menopause and provide women with the tools to embrace the second half of their lives with confidence. Thank you so much for coming on.
Thank you very much for having me. I'm really excited to be here.
Yes, me too. So you kind of got into this because of your own experience. Is that what made you delve into learning more about perimenopause and menopause?
Actually, yes, I went into menopause quite young. I didn't expect it. I knew nothing about it and I couldn't find any information. I went to the doctors, gynecologists, and they said, oh no, you're perfect, your blood tests are perfect, your uterus perfect. There's nothing wrong. It's all in your head.
Yeah.
I had several relatives that went into menopause really young, around 40.
Okay.
And they had been told to say, it's all in your head, there's nothing wrong. But then from one day to another, they were in menopause. I had very debilitating symptoms. I couldn't function anymore.
Wow.
It's not like that for every woman, I must say. There are women that have really few symptoms. Other women have very important symptoms like me, and we need to address this subject. We need to talk about it. We need to educate women so that when menopause or perimenopause begins, they know what to do. They can have a nice period, not just suffering.
Right. Right. And it's interesting because as a practitioner myself, it really is not taught much in school. I mean, we are taught that menopause exists and that it is a hormonal changes and, kind of what changes in the body, the basics, right? The decreased estrogen and the fact that it affects your genitalia. That's about what we're taught.
Yeah.
And you're not taught all these vague symptoms that are related to menopause. And it's very interesting to me. It's been one of my passions lately to start learning this so I can help my own patients because I'm not as well versed in it as I should be. And I'm realizing that the more I learn about it is, wow, there is so much to learn. So tell me kind of like, when does perimenopause start and kind of what are some of the symptoms that women might notice during the perimenopause part?
Okay, so we generally call it menopause the moment you have been without period for 1 whole year. Okay, so 8 to 10 years prior to that, it's called perimenopause. It can vary a lot, but you can consider that 8 to 10 years. Normally, menopause it's at 51 years of age, but it's considered normal from 45 to 55.
Okay.
This means that you can, have the first symptoms of perimenopause at 35, as early as that.
Wow.
And we should also consider there are women that have POF, premature ovarian failure. It can happen in your 20s. Or there are women that are obliged to go into menopause because they are following treatments like, for example, chemotherapy or other medical conditions. So it's something that can, apply to many young women, not only after their 50s.
Yeah.
Therefore, look for the symptoms. If you don't feel yourself anymore, for example, if you have many mood swings, if you're starting to have brain fog, you're losing a lot of hair, weight gain, this is the first signal. You're starting, to gain weight without knowing how. You
Yeah.
do exercise, you do all the right things, you have a good nutrition, and still you're getting fatter because you
Yeah.
can gain many, many pounds, without changing anything in your life. Your skin begins to become dry, very dry, everywhere. And now we will
Yeah.
talk about it. Yes. Also, a lot of so called strange symptoms because they're not directly related, but you're starting having problem with your gums, for example. Yes, you don't go to the bathroom like you used to do anymore.
Right.
Problems with the bowels, very strong problem with your back. Pain here and there. You're not able to do some kind of efforts. Frozen shoulders that you
Mm-hmm.
never consider, before because you do exercise. You do your training, you do your cardio. So these are some of the most famous, of course, hot flashes.
Mm-hmm.
Most of the times when you have hot flashes, doctors tell you, oh, you have to check your thyroid, which is, of
Mm-hmm.
course, right. You have to do it because, those conditions can overlap. But sometimes, even if you have an autoimmune disease, if you have thyroiditis, it can be hot flashes. They are different. You must learn how to distinguish because the classical hot flashes,
Mm-hmm.
it's like having something, burning deeply here. It starts from the lower neck, and
Okay.
you wake up in the night completely wet. You have to go and have a shower, and you have to change completely what you have in your body because you're totally wet. This is not
Mm-hmm.
normal. It's not tired. Doesn't
Yeah.
doesn't work like that. I can tell
Yeah.
you by experience. But sometimes you don't have all these symptoms. You can have just, very, very few symptoms. Like I said, brain fog, you cannot concentrate anymore, you feel strange, and you get really angry for really
Mm.
stupid reasons.
Mm-hmm.
That's the beginning. And you may have cystitis, which is another symptoms. It can be related to that
Mm-hmm.
because when we have the decrease of estrogen and also all the other so-called sexual hormones, which I don't agree much because if we call them like that, it's like they only are related to reproduction, and it's not the
Mm-hmm.
case. Because as,
Right.
as you may know perfectly, they regulate so many functions, important function in our
Mm-hmm.
body. So when we start to lose them, the backlash, it's important. And when we lose our estrogen and the estrogen levels start to decrease in perimenopause and go down to zero after
Mm-hmm.
menopause, it happens that, as I said, we lose collagen. Our
Mm-hmm.
skin begins to become very dry. So down there, our vagina and our vulva become very dry,
Mm-hmm.
and the walls begin to become very thin, so thinner and thinner with the year.
Mm-hmm.
And one of the consequences, as I said, is that you can have more cystitis.
Mm-hmm.
And also because, not only because the walls are so thin, but we lose our good gut bacteria. So our microbiota,
Mm-hmm.
the microbiota, it's important also for our sexual functions. So we
Yes.
don't have the good bacteria down there, and the bad bacteria start to rise.
Mm-hmm.
So when we have all these urinary tract infections, in fact, what happens that is we have a lot of itching, dryness, and sexual intercourse began to appear quite painful.
Mm-hmm.
And if we don't treat properly this issue, they're gonna be very, very painful, to the
Yes.
point that some women prefer not to have them anymore.
Mm-hmm. Yeah, and I would say for me personally, that's what I see a lot in practice because I'm in urology. A lot of the women are coming in with recurrent UTIs, and then I get the opportunity to talk to them about their perimenopause and menopause because of the thinning of the tissues and things. And I tell them, the tissues are so thin now, where you used to be able to wipe or wash pretty vigorously. Now that could cause little tears. Sex can cause
Exactly.
little tears. And like you mentioned about the bacteria, now there's more bad bacteria which is going to get into those little tears and cause problems. And so it's a really big issue, but that is where I get a lot of my patients coming in for menopause help is because of the recurrent UTIs. And so that kind of opens the door for me to help them with more of their symptoms.
Yeah, another very important symptom which is related to that is we're not as moist as we were, even in a state of great arousal. Our body
Mm-hmm.
doesn't produce the necessary moisture. Also,
Right.
because we don't have enough estrogens. And if you think all of that, it may seem quite tragic, if we
Yeah.
talk about it like that. It's not tragic. It can be difficult, but
Mm-hmm.
as I said before, if you address it, it's not going to be a tragedy, but just something to solve. What is related to that, because it's something that has a physical base, it's the so-called female sexual disorder.
Mm-hmm.
It can appear also when you're younger, of course, but the majority of women that experience it are in this range, starting from menopause to early menopausal year. And there are let's say, five reasons to have this disorder. One, it's a relationship disorder, which
Mm-hmm.
is very common because maybe you have been with your partner or with your spouse for quite a long time. There are several issues that you never really properly address. You have problems in your marriage or in your union, and what happens is that many women are going so much, they're going through so much in their lives, they don't want to put up anymore with their man.
Mm-hmm.
So sometimes, it's not something that is really sexually related.
Mm-hmm.
Sex is just a symptom of what's underneath, and it's not
Sure.
functioning. So we cannot fix that. Okay.
Yeah.
If we go to an organic field, let's call also an orgasmic disorder, means that you have problems reaching a climax, a problem that you didn't have before. If you
Mm-hmm.
always had this problem, of course, the root is different. In this case, is related to all the changes you are experiencing physically. Also, the arousal disorder is, is related to that. And we have pain as well, because even
Mm-hmm.
if you don't have an arousal disorder or an orgasmic disorder, you simply cannot have sexual intercourses if they're painful for you.
Mm-hmm.
Many women don't say it loud because they feel guilty, they feel wrong, they feel
Mm-hmm.
broken, because all of a sudden, they can't satisfy their partner anymore. Their body is like an enemy, you know. They don't get wet, they don't get enough aroused,
Mm-hmm.
they don't react as they should,
Right.
they cannot climax. But as I said, it's something very, in many cases, very mechanical that we can
Mm-hmm.
solve about it. Also, if we have hypoactive desire disorder that that encompasses all I've said before, we have medication. I think in the sites they are called ID and Bailisi, if I'm not
Yep.
wrong. So it's a condition that can be treated. But before going to that, because not many women have all of that, maybe they have some of the above, there
Hmm.
are many, solution before. One very simple, it's using estrogen.
Hmm.
An estrogen cream
Yep.
that you can use down there on your vagina every day, like you use a moisturizer on your face.
Hmm.
Many gynecologists don't want to, prescribe that because there are hormones that can be harmful. Let's just, break it down. It's not like that. They're really
Right.
a small amount of estrogen down there.
Right.
It's not dangerous, not even, for breast cancer survivor, but it can do a lot of good. It can
Yes.
restore your walls, your tissue,
Hmm.
and you can actually function as you did before. So, a little
Yeah.
cream, big result. So,
Yeah, and
women,
it's one of my
ask
favorite
for
things
it.
to prescribe. It's life changing for women, and you're right with as far as the breast cancer and stuff. I have read the research studies. I know that it's not changing the blood level of estrogen. It's very
Exactly.
locally absorbed. But if I have patients who have had any of the female cancers, breast cancer, endometrial, uterine, whatever, especially if it was estrogen positive breast cancer, I do always check in with their oncologist and say, this is what we're thinking. Let's double check that we're okay. Some of them, if they're too close to when they just had treatment, they might not want to start it for another year or two. It just kind of depends. So I like to check in with the oncologist just to be sure. But I've only ever had one oncologist in one particular case say no. Other than that, it's like, sure, or let's wait 6 months to a year to get out of treatment and then do it, something along those lines. But I've only ever had one say no.
That's very good, actually. At least here
Hmm.
in Italy, it's almost impossible to have it because they say it's too dangerous. This is a
Mm.
kind of mentality that needs to be changed. Also, with the systemic therapy.
Hmm.
I'm not saying that everybody should be on hormone replaced therapy, but if you are good candidates, just consider it. Think about it, have a
Hmm.
conversation with your doctor. Ask for it because the trouble is they don't prescribe it. And if you
Yeah.
don't address it during a conversation, when you are on a consultation, nobody will.
Right.
And I'm not saying that HRT saves marriages, but in
It
some
can.
cases it does because
Yeah.
the systemic cure not only cures your physical symptom but also the psychological symptoms
Hmm.
because until now we talk about certain symptoms that are related to intimacy, but the other side is that you have a very strong effect on your brain as well.
Hmm.
Actually, still many doctors says it's in our head. Now we know that it's in our brain because it's proved. Dr. Lisa Mosconi, which is Italian as well but
Yep.
works in the US from many years, she actually discovers that after menopause, our brain receptor for estrogens increases. So everybody thought that after menopause, our brain that shut down, no estrogen receptors. Instead,
Hmm.
they go up and up. And we have estrogen or progesterone receptor all over our body, actually.
Yeah.
So that's why they're so important. So not only you don't recognize yourself anymore because your body's changed so much, but also you can feel depression and low mood.
Hmm.
Some women became suicidal. I'm not joking. Women
Yeah.
that were perfectly balanced and all right in a short period of time have suicidal thoughts they never had before.
Hmm.
This is, of course, we rule out people that have important problem that can cause that. I'm talking about people that had no reason to, to have this kind of thoughts or to be depressed.
Sure. Right.
And with the hormonal therapy, what they reach is the balance they had before. So when you take the hormonal replace therapy, you can, I'm not saying you have your body back like you were in your 20, because it's not possible, but certainly your body begins to function as it was before. So you have a clarity of mind, you're not more confused, you don't have low moods, you don't have bad thoughts. You can perform, especially if you're working in a certain field like yourself or myself. You need to perform. You need to be at your best. Every day, 7 days a week, and you have to be a mother, a lover, a wife, a partner as you were before, because sometimes menopause takes all of that away from you.
Yeah.
But with something simple like, a pill, a patch, a gel, because there are several forms, you can decide which one is best for you. You can have all of that back. Of course, this is not a magical solution, okay? So it means that in your intimacy with your partner, you still have to act some adjustments. And
Sure.
we should think about it. Of course, I'm talking from men-women point of view, because
Yeah.
the more painful sex is actually when there's a penis into a vagina.
Right.
So first of all, we have to talk about it with our men. It's a discussion we must have with our men, because they know nothing. If you know a little, men don't know anything. Nobody told them, right?
Right.
Because men, they don't even know their own bodies most of the times. So you really have to talk with them, being open, not when you're having sex, not just before or just after,
Right.
possibly. Choose a good moment
Yes.
and talk about it, and really say something like, I like, being intimate with you. Is something really beautiful, something really important. But I cannot be as I was before. It's not that I don't desire you anymore, because this is something that happens frequently. Men don't feel wanted anymore.
Yeah.
And they are looking for or a divorce or somebody else, because they don't feel wanted anymore. Many women come to me and said, my husband said, it's clear that I don't want him because I cannot get wet as I used to do before.
Yeah.
So they get offended. They feel less of a man. So this is a vicious circle that we, absolutely, we have to break. Talking is good. Asking for what you want is good. Explaining them what is painful, what is not painful. Trying to change, the path. For example, we are used and we are taught in many cases, like, that just vaginal sex, so a penis in a vagina, that is sex. It's a way of having sex. It's not just.
Right.
No? Okay.
Not the only way.
There are many other. Okay.
That's right.
So, first of all, let's try to include our new different ways and prioritize the less, the other part of our bodies, including our skin, because our skin is a sexual organ.
Yes.
It's very receptive. So let's try to work on that, and always try to remember that our clitoris is the primary source of our pleasure.
Right.
And because stereotypes are still here with us every day, so we are taught that a real woman has vaginal orgasm. Now, this is a great subject of discussion. let's just say that it's not true,
Hmm.
that you cannot, get the party started without the clitoris.
Right.
So you want to have both. If you cannot have both for several reasons, because, for example, you're not taking any estrogen,
Hmm.
not even as a cream or as a systemic therapy. So you're very dry. Better, focus on something else. You can be satisfied. Your partner will be satisfied as well. Also, let's begin to use moisturizer. There are some,
Hmm.
with hyaluronic acid, the same that we use for our face, that can
Hmm.
work a bit, not as good as an estrogen cream. And lubricant.
Hmm.
This lubricant must be our faithful companion.
Yes.
So imagine that every time you want to have penetrative sex, use a lubricant, oil based or silicone based, which is very important because if you use water based, the water is absorbed by the tissue. So,
Hmm.
it doesn't work as it should. Use silicone.
I'm going to add a little caveat to that because if a woman is having recurrent UTIs, those are more difficult for her to maybe wash off afterwards.
Yeah,
And
that's
so
true.
for my women with recurrent UTIs, I do like them to use the water based lubes, just that they're going to have to be reapplying it during the
Yeah,
session, whereas the other ones they won't. But they do wash off a little easier afterwards. So, specifically, my ladies with recurrent UTIs, at least early on before we get you on the estrogen and get you back to being
yeah,
healthy down there, the water base might be better for some of them. But I completely agree. Regardless, use all the lube, reapply when you need it, and just don't feel bad that you used to be able to provide enough lubricant and now you can't because it's not your fault. It's just the way your body is. And I had a patient who she was great, but she came in for recurrent UTIs. And, just because of the nature of what I do and what we talk about during those visits, she was telling me that she doesn't even let her husband touch her because the last times that they did, that's when she would get her UTIs. And it's so painful and all these things. So we got her on the estrogen cream, and the next time she came back, she wasn't having UTIs anymore. She was feeling great down there and wanted to start having sex. But now her husband was dealing with ED. And so then she had to send him to me. So now I have both of them as patients because
okay,
he was taking such a long time to get erect that then that was giving her issues, even though they were
of
using the
course.
lube and she was on the estrogen, just that constant friction of trying to get him hard enough, and then he'd get hard and they'd penetrate for a couple minutes and he'd lose it, and then they'd try and get him hard again and they'd penetrate, and it was such an ongoing thing that caused her discomfort and irritation and itching and those kinds of things, again because of the lack of estrogen and blood flow and all that good stuff. So it is definitely an important topic for our ladies, and for,
Yeah,
like you
that
were saying, for their partners to understand and have that conversation with them, and to know that just like for women, our partner's ED is not our problem. We're not the cause of that. Neither
exactly.
is it our partner's fault that we can't get wet enough anymore, or that we have psychological things going on where the desire is gone now and things like that. So I think your point was totally correct with getting the partner involved.
Yes, as you said, friction. I'm not saying we have to
Hmm.
avoid friction, but we cannot think of having the same, friction we had before, when we are in your 20s or in your 30s, even in your 40s, because it can be painful. You can have,
Hmm.
scars. It can happen. And as I said, you have to rethink your way of having sex. It doesn't mean it's not pleasurable anymore, but that,
Hmm.
that you have to adjust to something else. Also, a lot of therapists do suggest to use porn, to get excited,
Hmm.
because men have issues as well when they
Hmm.
reach their 40s, their 50s. It's not just us. Menopause, it does exist. It's not as heavy as menopause, but they can have
Yeah.
problem as well. But what happens is that if you give them a porn, you still put them in fake situation. Like,
Hmm.
expectation are so different from reality. both for men and women. And what happens instead is we have to stick to reality and find the good and the beautiful aspect of a different sexuality. So use something to get excited, to have a good arousal. Yes, it can be, something steamy, steamy films without being porn, but steamy with good actors,
Yep.
even a story. As I was an editor before, I strongly suggest, even to men, to read romance novels because some of
Yes.
them are really hot. You have to
Mm-hmm.
read them and let your mind follow.
Yes.
Um,
I
they are
agree.
source of inspiration.
Yes.
Sometimes they also they also give you directions.
Yep.
Sometimes,
And a
but
conversation starter. Yeah.
something that I struggle to let people understand when we talk about desire, it's not just physical desire. Desire is the driving force in our life. We were born because of desire.
Mm-hmm.
We thrive because of desire. Every day we wake up, and if we don't have a desire for something, for somebody, it's, the wanting, the deep wanting, Without that,
Mm-hmm.
it's like our internal light is dimmed, we are flat.
Mm-hmm.
This is why important to have desire, and sexual desire is one of the forms. So let's feed us, something beautiful, something sensual in every
Mm-hmm.
day. It can be food, it can be art, it can be cinema, it can be music. All of that, can create physical arousal.
Mm-hmm.
It's true that men, they have more spontaneous arousal because their kind of desire is very much like there is whatever it happens, it's there. Women have a more reactive desire. So let's learn to conjugate those two, because what happens, it really can, create beauty.
Mm-hmm.
But there's a little work to do about it, and just go of stereotypes of what society asks us, because you are a woman must be like that, you are a man should be like that, after a certain age you should do this and that and not that one. Pressure is great, on our shoulder, and since we are aging, think with our mind and to follow what's good for us.
Mm-hmm.
If it's good for us not having sex, we should do it. I know this is an
Mm-hmm.
unpopular opinion,
Yep.
but really, everybody should, follow what, what's the best and what's, fits their internal soul. For some people, it's not necessary. For many people, it's so necessary. So,
Mm-hmm.
they, frequently having fun of women trying to be attractive or having a good sex life after a certain age, because
Mm-hmm.
maybe in US it's like that when you're 40, 35, off the pasture. Yeah, it's
Mm-hmm.
like it's not like that. You can't be sensual. You can't be a sexual being. Why not?
Right.
It's not being vulgar, not being gross.
Right.
It's what you do in your intimacy.
Yep.
So let's pursue that.
Yeah. I agree. And that's one of the reasons why I started this podcast is because, and you guys are better about it in Europe than we are in America. Sex is not talked about as open naturedly. We don't have nude beaches and topless beaches. We're very prude here in America. Uh, so it's different. And I want people to talk about it and to have that comfort level. And especially about the stuff that's hard to talk about. For example, for the women, it's the menopause symptoms.
Yes.
And your girlfriends might talk about some parts of it, but they might not talk about how painful sex is and how you
Yeah.
don't have P and V anymore. And
Yeah.
you guys make out now and you maybe do mutual masturbation instead of penetrative sex. Or, your level of intimacy now is cuddling at night for 5 or 10 minutes instead of penetrating. And I think that's such an important thing to put out there, that if you can still handle penetrative sex and you love that and that's for you, awesome. Go for it. I hope that works for you and your partner. And if not, go get help so it can. But if that's okay for you to give up, that's all right too. I have patients in their 60s who are like, nah, I'm good. I don't need it anymore. We have other ways of being intimate. And then I have patients in their 80s who are like, no, I need help. We still need to have sex. So it's very individual. And I love that. And I want that to be more of a popular opinion, that it doesn't have to mean penetration, that
Exactly.
sex and intimacy can mean so many different things, and whatever it means to you is okay.
Yeah, and we shouldn't be ashamed. I'm not saying that, of course, you have to go on the street and say, hey, here is my sexual life. I want to share with
Right.
you. Of course not. But even among, girlfriends,
Mm-hmm.
women, after a certain age, they don't admit they have problems. They come to
Mm-hmm.
me, okay, because it's something private. It's a session, a consultation, but maybe they've gone out to a dinner with the best friends, saying, well, yeah, it's not as it was before, and
Mm-hmm.
it ends here because they fear the judgment. And as I said before, they fear it's their fault. They fear they're broken, and of course our body has changed. Of course,
And it's
eating.
interesting
You
because
have a
we'll talk to
problems.
each other. Yeah, and we'll talk to each other about our periods. We'll talk to each other about, our periods stopping, and oh, I made it 7 months, but then doggone it, it came
Right.
back. So I guess I'm not in menopause. We'll talk about that side of it with our friends, but not the sexual side of it.
No.
And that's sad. I mean, we need to let people know that it's normal that when you're going through this massive hormone change, that you're going to have changes not only in your body's sexuality but in your mental sexuality as
Right.
well, and kind of learning your new normal and what feels good now versus what felt good even 5 years ago.
Absolutely. Also because if, as I said before, for me, the better option is to have, hormonal replacement therapy, which includes
Mhm.
estrogen and progesterone. But for example, if you cannot or don't want to, uh, you want to use a cream, that it's estrogen based, but you can use also a testosterone gel.
Mhm.
Testosterone gel helps a lot with desire. The so-called
Yes.
libido. I don't like very much the term libido, but you'll say, the
Mhm.
difference. You put a gel, and it's easier to get aroused. Estrogen and testosterone together, a very good match to help you like that. If you want to have sex and your vaginal atrophy, it's really serious because, as I said before, the less you use it, the less you're able to use it. So our vagina is
Mhm.
like a muscle. We do have to exercise it, otherwise we face complications.
Mhm.
So also vaginal atrophy can be cured, let's say, it can be treated. Cured is not the right term. So use gel, use cream, use try to find a good, pelvic floor
Mm.
therapist.
Yes.
Uh, that can help a lot, especially if you had, several children. That is very important, that kind of rehabilitation. And last but not last, you can have laser therapy because maybe you've heard of
Yep.
it. I don't know if you call it like that in the US as well. I think it's Mona
Yeah, we have a
Lisa.
couple different companies. We have a Diva and Mona. There's a couple different laser
Yeah,
therapies for the vagina, and they work
yeah,
fantastically.
they do work a lot. So always think that there is a solution, there is a therapy if you want
Mhm.
to. Whether you're 50, 60, 70, or as I said, 80, because I know
Yep.
people that are 80 years old and they have their intimacy. There's nothing
Hmm.
to laugh about it because they're not, like models anymore. The body's
Right.
not perfect, but I think it's very sweet,
Hmm.
to see two people that want to share everything
Yeah,
still. It's so beautiful. This is
it is.
life. As I
Yeah.
was saying, the desire is what drives our life.
Hmm. Yeah, I love that. And I had a patient too who she hadn't gotten help for a long time because this is a newer thing that it's people are actually talking about it and treating it in the way that it should be treated. And so she had not had penetrative sex in quite a while because it was so painful. And we were able to get her on estrogen her and her husband tried having sex and it was extremely painful. So we were able to not only send her to pelvic floor physical therapy, but to get her some vaginal dilators. And she started with very small ones. She would wear that for 30 minutes. And then she gradually made it, larger and larger with the dilators. And then they were able to have penetrative sex. So for some women too, it's not a light switch that, a week after using this estrogen, you're going to feel fantastic. You may still have to do some other things to get there, but we can get you there if you want to get there.
Even if you never use toys, you have, in this case, it's not really toys, there are devices that help you.
Yep.
Because in these cases, they can help you a lot. Maybe before you can do it, for a recreational purpose, this time it's actually to cure you. They help. So, as I said before, consider what you didn't consider before. Because it can't be of aid. Don't feel ashamed and to ask. We have to learn to advocate for ourselves. That's very, very important. And I have a young daughter. She's only 8 years old. But what I'm trying, to teach her is that if you need something, never be ashamed of asking. Mm-hmm. Because if something is important, I'm not saying you want, you need. Talk about it. Be open about it. If you feel discomfort as well.
Yes.
So it's not always women satisfying men. Mm-hmm. You're a little younger, but this is what we were taught, Women should satisfy our men. Mm-hmm. If you get satisfaction, it's secondary. First, and most of all, the man. It's the center of everything, so he must be satisfied.
Right.
It's not like that anymore. We are equal. Also, the pleasure when, it's shared, it's much higher and much deeper. If it's just, you servicing your partner, it's not good. What kind of relationship do you have? You will have resentment.
Absolutely.
So it will impact, also other aspects of your union. So be vocal about it.
Yeah.
Both of you must reach pleasure, which doesn't mean necessary to have classical orgasm, as we said before. You can orgasm in different way. The goal is to reach a climax. Yeah. Doesn't matter which way you take, but you have to get there. You have to.
No, I love that. And this
is
such a great conversation. I really appreciate you coming on. I think we could talk about menopause all day long. I think that there is so much to delve in here and to get more in depth with the hormone replacement therapy and all of that. But I really appreciate your focus today on the sexual side of it and really how to kind of help women start to overcome that, have that conversation with their partner. Just a fantastic topic. You are incredibly knowledgeable. So I really appreciate you coming on here. I'll put links in the show notes so that our listeners can find you and follow you because I know that you're on Instagram and you have a fantastic page there. I've gone and looked at it myself.
Thank you very much.
So thank you again for coming on.
Thank you very much for having me. It's been really a pleasure.
Great. Thanks so much. Everybody have a great day. We'll see you next time Between the Sheets.
Bye.
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.